The Hawks have conducted raids at entities and homes of numerous high-profile individuals in Gauteng. Officials say this is in connection with an investigation into 1 billion rand at Tembisa and the fraud that took place at Tembisa Hospital. So let's focus on the impact now of corruption on health systems and bring in our guests. The Maverick Citizens editor is Heywood, and also joining us is the Deputy Secretary for the People's Health Movement South Africa, Dr. James van Duuren. To both our guests, it's lovely to see you. Thanks very much indeed for your time. Mark, perhaps let's begin with you. We've had multiple conversations around what is being done in response to what we now know may very well have led to Babita Deokaran's death as an example. I wonder whether you get the sense that finally these wheels of justice, which yes turn slowly, are turning nonetheless.
Good morning. Yes, I mean the raids by the Hawks are most welcome. And do suggest that the investigations have been proceeding and that the investigations are reaching some sort of conclusion. You know, we're almost 2 years since Babita Deokaran was assassinated, August 2021, and we still don't know who ordered that assassination and who stood to benefit most directly from that assassination. So it's a good sign, but it is still insufficient because corruption is epidemic in the Gauteng healthcare system, and I'm afraid that the Tembisa Hospital corruption is not unique to that hospital, but is spread across the big tertiary hospitals in this province. And there have been a whole number of reports by the SIU, including one report that is still sitting with President Ramaphosa that he hasn't released, into hospital tender corruption and construction corruption. And my fear is that, you know, that the SIU, the authorities, are getting overwhelmed by this, are not getting the resources that they require to see through these investigations and prosecutions, and that consequently some of the corrupt people will escape justice. And that's a terrible thing, because you ask about the impact that this corruption is having. Well, it is devastating the Gauteng healthcare system, because doctors and nurses work in hospitals without basic facilities, with broken equipment, in broken infrastructure. They desperately need the types of money that has been stolen out of the system.
Yeah, and I suppose what really makes the situation a whole lot more devastating is that those are healthcare professionals who are keen to do the job. In fact, many of them are sometimes digging into their own pockets in order to ensure that they can meet their obligations. Dr. James, you, I suppose, have a clearer understanding of what that's like. And as Mark mentioned, what's happening at Tembisa Hospital really just feels like a snapshot, this cross-sectional snapshot of what is really quite pervasive, especially when you consider that the Hawks themselves said they're investigating 200 entities linked to this one particular tender corruption.
Yeah.
Yes, certainly. I mean, I think investigations like this are the tip of the iceberg. If we're using the SIU as a marker for the level of corruption generally, we're sort of missing the boat. We're looking at the end result of these major incidents of corruption, when there is certainly they are to be indicative of sort of the lower level mismanagement of funds. And to speak to Mark's point, I mean, 1 billion rand is a lot of money, but it's even more money if it's applied in a community or primary care setting. So while these hospitals are drawing huge amounts of funds, there needs to be an equal amount of accountability built into the system to ensure that these funds are not mismanaged.
Yeah. Speaking about accountability, I mean, I suppose, Mark, there's a lot to be said also about the attitude of government towards concerns you've been raising for years and the possible red flags.
Yes, there is. I mean, people, as you say, people have been raising red flags about corruption in the Gauteng healthcare system for more than a decade. You have to remember that it starts in 2008 or 2009 with the then MEC Brian Tlongwa, and who still, by the way, has not been prosecuted and is not in prison, has not been found guilty. And it continues ever since then, and it has caused a hemorrhage in this system. And, you know, I wonder what should be done and what can be done, because the Gauteng health management, senior health management, seems to have imploded. Once again, there's no head of health in Gauteng because the last head of health resigned a couple of months ago. And, people who work in the healthcare system, both at the primary level that James talks about, but also with these huge tertiary hospitals, complain that they are unable to get anything done. Just to give you, again, an example, for perhaps 2 years now, the most senior officials in the Department of Infrastructure Development in Gauteng have been suspended for precisely being linked to these types of incidents of corruption. But nothing seems to be happening. So doctors and health and facility managers have to approach a department, the Infrastructure Development Department, that doesn't have many of its key staff because they're suspended. So they're in a vicious circle where money is being stolen and the administration has broken down, and there doesn't seem to be any urgency to address these things.
Sure. As you're speaking, Mark, I'm reminded by remarks made by Dr. Malekapuru Makoba, who, of course, recently released a report around what's taking place at Rahima Moosa Hospital. Part of what he found is that there seems to be a rot, as we say in English, that begins at the head, right? Just the ways in which some of these CEOs have been appointed is where some of the issues begin. Does that resonate with your experience, James, that in many of these instances, it's actually the dysfunctionality at a leadership level that leads to everything else unfolding in the spectacular way we've seen?
Well, as a public sector employee myself, I must say that I'm speaking in my role as a member of the People's Health Movement here. And I will say that what is most notable is the effect this has not only on patients but on clinicians and care providers. It builds a sense of hopelessness that you're unable to procure the tools and resources that you need because funds are limited given the state of the national fiscus. And when you then see that these large amounts of funds are being mismanaged, it causes a further sense of despair. It also builds a sense of complacency that you're unable to fix these things. And what's the point in sort of trying to go above and beyond if you are unable to get support for your basic care needs? Certainly, it's a leadership problem, but I think we have to look at building systems that are in and of themselves resistant to this type of corruption. So obviously the Public Finance Management Act states that the core principles of procurement should include fairness, equitability, transparency, as well as cost effectiveness. And we therefore need to make sure that these sort of large-scale procurements, which we saw happen during COVID, which are motivated by a sense of urgency about the problem, don't have the level of scrutiny that they should have. And we need to build in the accountability mechanisms, including accounting, auditing, making sure that there's correct oversight of decisions made by clinicians who are in the procurement process. Just because I'm a clinician does not mean that I would have the best interests of my patients at heart, you see. So we have to make sure that we're not just relying on individual acts of goodwill, individual whistleblowers to point out these large events, but that there is already a check and balance system in place, that these sort of large-scale purchases that are out of keeping with cost, that are not being put appropriately to tender, the tender process is not transparent, should be setting off huge red flags and alarm bells in highest levels of management. And if those systems are built in that there's no way to get around them, that's really how we will tackle this problem. Yeah,
that's interesting. Mark, I wonder whether you reckon we already know what that looks like, because there are mechanisms there. The Finance Management Act is there, but it hasn't stopped people from flouting it.
No, there are mechanisms there, and I think what James has just said, indicates how you could manage this if there was political will. The problem is that there doesn't seem to be political will to sort out the health departments at provincial level, and perhaps that's the question that we should be asking. Again, I end here in Gauteng, a year ago almost, a memorandum of agreement was reached with Wits University, because obviously the Gauteng health department shares a teaching platform with Wits University, that would have led to greater transparency, that would have led to the consultation of the university and the Dean of the Faculty of Healthcare Sciences in critical appointments at the level of CEO, COO, etc. of hospitals. Nothing has been done to implement that memorandum of agreement since it was signed by then Premier Makura a year ago. So what James is telling you, what I'm telling you, is there are small but significant steps that could be taken today that would improve the situation, that would prevent theft, but then have this positive knock-on ripple effect into the healthcare system in improving the morale of people who are working in the healthcare system and ultimately and very quickly improving patient care. Because the critical thing to understand is that there are brilliant doctors and nurses working in the public healthcare system, but they are working in a disaster zone, and part of that disaster zone is often related to the fact that so much money is being stolen out of the system, so that the basic needs that they have for infrastructure, for equipment, for staffing are not being met.
Yeah, and one wonders whether we've come any closer to being able to quantify just how much money is being taken out. It's a sobering discussion, and gentlemen, thanks for giving us your insights. Really do appreciate it. Mark Heywood is the editor with Maverick Citizen. Also joining us there is Dr. James van Duuren, who's with the People's Health Movement South Africa. Once again, thanks very much indeed.